our job is hardcore.
There's all sorts that can happen.
Everything we do relies on this bond between us all.
Just stay down. No.
You're okay, you're okay.
You have to be comfortable in high-stress situations.
Save a life, and you're a hero.
You're in the hospital.
How much? Do you want to tell me what drugs you want to win?
Save 100, you're a nurse. In Australia, 1 in 10 nurses hails from the United Kingdom.
It's a bloody good job. It's so good.
Big deep breath in.
Through their eyes, you'll see life.
Push.
Good girl!
Death.
Unfortunately, we can't save her.
And everything in between.
Coughs, colds and sore holes.
Welcome to the front line
2, 3.
of one of the world's toughest
It's all right, darling. We're looking after you, okay?
and most trusted professions.
It was scary, hey?
Nurses are superheroes, without capes, just in scrubs.
No drugs, that's for friends. Alcohol.
St Vincent's Emergency Department, one of the busiest trauma centres in Australia.
Take a deep breath in for me again.
Everyone got a good hold. On 3. 1, 2, 3.
1,000 patients every week.
I'm just going to take it off, okay?
1 in 5 of those cases demand urgent, life-saving attention.
One. Yep. Cat2 trauma alert triage. Something always happens in emergency. It's unpredictable. Some days it's putting stickers on everyone's folders, and then the next second you might be doing CPR. You just never know. As soon as the phone rings, it could be anything. St Vincent's Emergency.
A call from the paramedics puts everyone on high alert.
Standing by for 418.
We are coming to you. This gentleman has jumped in front of a train. The majority of the train has passed over the patient, but unsure whether it has hit him. We will be with you in approximately 5 minutes.
Going to the green zone in 5 minutes.
Got a trauma coming in, so someone's jumped in front of a train. We're just preparing for the worst, just in case.
1, 2.
Well, good afternoon. This is a male picked up from the train station with a head strike against the train tracks. It seems like the train has slowly overpassed the patient. 3/4 in, patient self-extricated off back onto the platform. The patient has sustained a 5 centimetre laceration to his head. He's got small abrasions to his right elbow and his right shin. He does say he's a bit sore all over.
Do you know what happened this morning?
Oh, no.
No? Do you know why you're here in hospital?
Externally, his wounds appear to be minor, but it's what can't be seen that's of greater concern. Yoon and the medical team need to thoroughly investigate the full extent of his injuries.
Just see what his tummy looks like.
An ultrasound will check for any internal bleeding or damage to his organs.
Another drip into this arm, okay, darling?
He may also have a brain or spine injury.
The whole T-spine is tender, so we'll put on that soft collar. Where's your pain?
Oh, just hold still, mate.
Your pelvis.
We're just trying to protect your neck and your spine. You've been in a pretty big accident, okay?
I can't breathe. Help me.
He says he can't breathe.
Suddenly, the patient is fighting for breath.
Please help me, please.
The team needs to find out why, and fast.
I can't breathe.
It's okay, mate. We're right here.
Help me.
We're just trying to protect your neck and your spine. You've been in a pretty big accident, okay?
Help me.
We're just trying to protect your neck and your spine. Okay?
Help me.
Today is ICU nurse Ali's last shift at St Vincent's Hospital after almost 5 years. It's one of Australia's busiest intensive care units.
I've worked in intensive care for years. No 2 days are ever the same. There is no complacency in our job. Every day is different. You still see medical mysteries.
It's my last day today. Bittersweet.
I am moving to London for a few months and then I'm going to move to Edinburgh in Scotland. I've lived in Sydney my whole life. I've been at uni in Sydney and now worked in Sydney.
Like, it's exciting and scary and all at once sad.
So I've decided to take the plunge and go.
Oh my God, it's so warm in here.
I do love the cold and rain doesn't bother me, so it sort of seems a perfect fit.
Morning. Oh, last time in Australia, I'm putting on my disgusting shoes. Hey, Soph. How was your night?
I became a nurse because I've always wanted to help people as much as I can.
Well, it's very good to see you with that tube in.
I just always loved medicine and anything to do with hospitals.
All right, darling. Can you sit her up?
When I was about 12 years old, I asked my grandma if I could have an anatomy and physiology textbook for my birthday.
JP drain in the lower abdomen.
I don't think many 12-year-olds would have asked for that book.
Thanks, Karen. Have a good sleep.
For her final shift at St Vincent's, Nurse Ali is facing something she's never seen before in her career.
Sats are 85%. SMAP's 50.
This poor guy's had a week of a cough and malaise and generally feeling unwell, which then was diagnosed as pneumonia.
As well as pneumonia, the patient is suffering from sepsis, a life-threatening toxic response to an infection.
I'm giving you 7 dads.
And the source of his infection is still unknown. It's an extremely unusual condition for an otherwise healthy man.
He was intubated, so a breathing tube was inserted because of his oxygen exchange wasn't good and he was having difficulties.
The patient is unable to breathe on his own. He's being kept alive by an extracorporeal memo-oxygenation or ECMO machine.
Yeah, I might just start doing the ECMO safety checks.
Yep.
ECMO acts by taking the blood out, putting it through 100% on an oxygenator and then putting it back to the patient. As you can see here, this is a lot darker than that. So this is deoxygenated blood and this is oxygenated blood. This is the most life support you can be on.
Taking blood out of a patient and putting it through a machine and then giving it back to the patient, there is a risk of getting blood clots.
So it must be there and there.
We are constantly monitoring the oxygenator and the cannulas for any clots. And if it went to their brain or their heart, they could die.
We're going to a CT scan to do a CT chest and a CT brain. So it's further investigations as to what's actually causing him to be so unwell. Okay, so Rugger, we've got cisatracurine, we've got it spare, we've got fentanyl, Midaz, Norad, Propofol. Do you want anything else?
Moving a patient on an ECMO is very rare and is fraught with danger.
We've got emergency packs, defib, drugs, 2 spare oxygen cylinders, and the ventilator oxygen.
It will take 5 clinicians to move him from ICU to medical imaging.
We'll go in foot first, so then we can take this around and go straight through into CT.
Sounds like a plan.
They will need to coordinate their movements perfectly.
We need to actually wheel the ECMO with us at the same time, so we all have to be in sync as we go. Because if someone was to move too quickly, you know, the lines here would detach or the ECMO, so it's a very delicate job.
Moments after the team start to move the patient, Ali spots a problem.
So are those sats right?
The sats are dropping, yeah.
He is very sensitive to being moved.
The patient's oxygen saturation level has dropped dramatically.
Wait, is the oxygen open and on? Just check it's open.
Yeah.
Is it open?
It sounds like it's not That's the 76.
Do you want me to bag him through? Yeah.
Prolonged, low oxygen saturation levels can cause long-term damage to the heart and brain and can be fatal.
Yeah, that does not sound right. Oh, God.
Downstairs in emergency,
Please help me, please.
We are, mate.
Nurse Ewan is treating a patient who jumped in front of a train.
Help me. I can't breathe.
He urgently needs a CT scan to check for head or spinal injuries. But first, they need to calm him down.
Look at me. Look at me. So you're fine. You're in hospital. Sit in. And we are here to look after you.
I can't breathe.
I'm looking at you and you are breathing.
Treating people with mental health is always hard. You know they're going through a hard time. It's okay, mate. We're right here, okay?
I can't breathe.
We're giving you oxygen. Just take some deep breaths through the nose.
Please help me, please.
We are, mate. As a nurse, we're trained to provide trauma-informed care. We provide empathetic care. It's important for me to help them as much as we can, emotionally, physically, whatever they need. I'm going to give you some medication for pain, okay? I'm giving you morphine, mate. Dan, I've given 5 of morphine.
Just then.
Yeah, just then. Does that feel a bit better?
With the patient now calmer,
Keep breathing through the nose, okay? Yep, keep doing that. Keep doing that.
he'll be taken for a CT scan to determine if the impact has resulted in a brain or spinal injury.
Then we'll slide all the way on 3. 1, 2, 3.
You just hold really still.
He did hit his head, so we're just scanning his head and neck. It's just that when you hear a train, an accident, we're looking at all differentials, making sure we rule out anything major. And hopefully he's all good.
In emergency, Nurse Ewan is anxiously waiting for the results of a CT scan for a patient who has been hit by a train. With the scan complete, the man is returned to the resuscitation bay as the results come in.
This is the train?
Yes. Good view. Look at that. So that's serious.
It's not good news for the patient.
Yeah, so he's got a hangman's fracture, which is in the cervical spine there, in the C2 vertebrae. And obviously there's a lot of nerves and stuff there, affect a lot of your movement in your body. It's quite a dangerous fracture.
So we'll do 4 spinal precautions.
Spinal.
I'll call neurosurge.
Okay.
A hangman's fracture is caused when the neck is snapped back and up. In the majority of cases, it's lethal, so the patient is lucky to be alive.
I'll get the doctors to come and have a chat to you about it, but it's very important you don't move your neck or get up, okay?
By moving even slightly, the patient could become paralyzed.
Do you have any pain in the back of your neck?
Just shoulders.
Because you've broken one of the bones in the back of your neck, okay?
Dr. Adam White needs to assess if the fracture to the patient's neck has damaged any spinal nerves and affected his movement.
Can you move both of your hands for me? Perfect. Can you wiggle both of your toes? Can you lift this leg off the bed? Good. And it looks like it's quite a stable fracture, luckily. What we need to do is have a chat to one of the spinal surgeons. We need to just keep you lying really still at the moment. He just needs to go into a special neck brace, and the neurosurgeons will sort that out and look after him.
Just give me 2 seconds. Oh, I'm so sorry.
That's it. We'll be a little bit tight.
With the type of fracture that he's got, if it was tight, like millimeters or a few centimeters difference, like it can completely sever your spinal cord, so incredibly lucky that it wasn't worse.
The patient will undergo surgery and will be admitted to the neurological ward for 6 weeks while the fracture heals.
Giving you some more pain relief, okay?
But he will also get the mental health care that he needs.
I think mental health is a tough aspect of patient care. It's hard knowing that people go through hardship like that. We're here to look after you, okay, so don't worry. It's very important for nurses to understand their needs, provide that empathy, even if you can't fix them right there and there. We've got a nice warm blanket. It's important for us to get the mental health patients the help they need. Is that nice and warm?
Yeah.
On Nurse Ali's last day in ICU,
So are those stats right?
All done.
a fit and healthy young man is being treated for pneumonia and sepsis from an unknown cause.
He is very sensitive to being moved.
Ali and the team are moving a critically ill patient to get a CT scan.
Wait, is the oxygen open and on?
But the patient's blood oxygen levels have dropped dramatically.
Yeah, that does not sound right. Oh, God. Sats are 76.
Do you want me to bag him through? Yeah. We like saturations to be over 95%.
Got the bag on?
When somebody's already on ECMO, sats going down can very much be life-threatening.
It's an anxious wait while the medical team check the oxygen canisters.
Sats coming up.
Yeah, sats are 95 now.
It was not a good sound.
He must have had some sort of leak.
Blockage in it or leak, yeah.
The patient's oxygen saturation has gone back up to a safe level.
Right, everyone good?
Yep.
And he can be moved to the CT scan room.
You right?
Yeah.
Too fast?
Sorry.
The man has been critically unwell for over 5 days, and with no medical history of his condition, it's hoped the CT scan will get to the bottom of the mystery.
So a CT scan is essentially a rotating X-ray. Everything's good? Yeah.
Yeah.
Yeah. Okay. So you are able to get a more detailed view of everything.
Keep going, keep going, keep going, keep going.
There's always something that, you know, I think that you're still shocked by. You still, I haven't seen that before, or patient presentation that's like, you still see medical mysteries.
ECMO will support the patient's life for now.
So day 5, you'd think he'd be getting a bit better by now.
But if the team can't discover the cause of the patient's infection, he may not survive. The Mater Hospital on Sydney's Lower North Shore is one of the country's oldest private hospitals. It has 15 state-of-the-art operating theatres using the latest innovations in surgical techniques. And for nurses at the coalface of surgery, every day presents a new challenge.
I think the dangers of doing any procedures in the theater is that even for minor surgeries, there could be a lot of things that you wouldn't expect to happen. We have to anticipate the worst. My name is Patricia. I am a scrub scout nurse in the peri-operative theater of the Mater Hospital in Sydney. I have been working here since 2014. I came from the Philippines. I've been a nurse as well there for 4 years before I went here, so I get to practice peri-operative nursing and then continue it here in Australia. I have been allocated to do Dr. Leslie's list, which he is a urologist, so he'll be removing a cancerous prostate today using a very high-tech equipment, which is the Da Vinci robot.
Patricia works in an extraordinarily sophisticated area of surgery which uses robotics.
The robot is really an amazing tool to use in surgeries. It makes the surgery quicker, and then they get to do more precise movements with it.
The patient is a 70-year-old retired rural mechanic, Peter.
I've been in hospital before, but I've always had someone with me.
Peter's left his family and other support behind to have this surgery.
This COVID, you can't have anybody at all. It makes it a bit hard, it makes it harder.
Jess is the admitting nurse.
Hey, Peter.
Hi, Jess, how you going?
I'm good. Are you comfortable there in the chair?
Yep.
Yep, lovely. So I heard you came in for a bit far away today.
Yeah, I came up on Friday.
Yeah.
Peter travelled from Biwa, more than 300 kilometres southwest of Sydney.
I'm going to come with you.
Oh, you come with me?
Yep, I come on your whole journey upstairs.
Well, someone should after me.
1 in 6 Australian men will be diagnosed with prostate cancer by the age of 85.
So just a couple of little bumps.
Prostate cancer is the second most diagnosed cancer in men and the third most deadly.
Knocks you a bit when you get told that you've got the big C, you sort of think.
Have you had bloods taken today? No. No?
But anyway, they're going to fix it, get it out. A bit like cutting rust out of a car, you cut it out straight away.
Had an ECG a couple of days ago.
Peter is not a stranger to hospital corridors.
Oh, I had a liver transplant 2 years and 7 months ago. I got through it all right, so I should get through this one.
Any heart-lung conditions?
Yeah, I've got 3 stents in my heart.
3 stents in your heart. Okay.
Previous major surgery on top of his cancer diagnosis can influence the outcome. It will be a particularly delicate operation left in the hands of a robot.
You wonder whether they're gonna get it all. Hasn't got away somewhere else.
Can you tell me a full name and date of birth, please?
Being chosen to work in a team that could possibly improve the life of a cancer patient, I feel honored.
Peter's surgery will be performed by urologist Scott Leslie.
Good to see you. You ready to go? Yeah. Do you mind if I have a quick look at your tummy, if that's okay?
Yeah, okay.
So you can see you've got quite a big scar here. So what we're going to try and do with today's operation is we're going to do the opposite of a big scar. We're just going to do minimally invasive surgery with a few small incisions on the tubby, okay?
Dr. Leslie will be performing the surgery using a robot. And while offering a more precise operation with less scarring and possibility of infection, there are still significant risks.
There's 2 main issues when it comes to prostate cancer removal in terms of functional complications. So one is incontinence of urine, and the other one is sexual dysfunction. At Mr. Martin's age, his main priority is the continence. I think with Mr. Martin's case, especially given his previous abdominal surgery, it might be a little bit challenging at the beginning, but I'm sure we can do a very good operation for him.
Take your glasses off at the same time.
The challenge will be if there's scar tissue from Peter's transplant. It would need to be removed before they can get to the cancerous prostate.
Dream time, baby.
Absolutely. And this one on, okay? And this is where you start having nice thoughts so you can dream nice dreams, okay?
The skills that we needed are really different from other specialties. This is Peter Martin, consented for robotic prostatectomy, signed by patient, signed by doctor, and he's allergic to tape and pylexia. We get to deal with surgeons, patients as well, equipment issues. Specifically for robotic cases is that when the robot plays up.
Okay, that's ready.
We have to prepare for the worst. It's hard, but that's what we do.
You happy for us to start?
Yeah.
Back at St Vincent's, Nurse Ali is caring for a young man with pneumonia and sepsis. How he became so ill is a mystery.
Just come a bit over.
Right now, he's being kept alive by an ECMO machine. His CT scan results are in, which the team hope will reveal the underlying cause of his life-threatening pneumonia and sepsis.
There you go.
The scan shows that the patient's lungs are full of fluid.
Late chocolates.
But the team still don't know exactly what has caused it.
That's anterior and that's posterior.
In order to find out, they are performing a bronchoscopy.
So that's structure up in the bottom?
Yeah.
Going deep into the patient's lungs to take a sample.
Bit of inflammation there. Yeah.
Oh, wow.
As you go down the bottom.
The sample results could provide clues to the mystery.
The secretions that came up did look quite purulent, and there was some blood in there as well. It's good that we've now been able to get the sample and we can send it off. And because it's deep in the lungs as well, we can get a bit better of an understanding of what exactly has been going on.
Just doing some, just freshening up.
While they await results for the bronchoscopy, Ali provides personal care for the patient.
So we have these shower caps, and then we can wash their hair.
There are some patients you just never forget. They stay with you. You're at it with the patient for 12 hours, looking after them, doing everything for them.
So we need to make sure, like any other person would in the community, they would wash their hair, keep up their hygiene, and these patients are heavily sedated. So we do those things for them. That's part of what we do.
The patients that come through the ICU are so critically unwell. Looking after them is a beautiful thing.
Much better.
So it's an anxious wait for the test results in a case that continues to baffle Ali and the team. The results of the bronchoscopy are back.
Very inflamed bronchioles.
They've revealed the cause of his pneumonia.
He's been recently gardening without a face mask.
It was a bacteria found in potting mix he'd inhaled whilst gardening.
Even though we do see some really, really awful and sad things, we do see some wonderful things as well.
It's expected he'll make a full recovery.
Not forever, not forever.
I'm using my ski buddy as well.
Not forever.
All right, welcome everyone. So we've had quite a busy shift.
As Nurse Ali is ending her final shift in ICU before her move to Scotland, Scottish-born nurse manager Darren is starting his shift in emergency.
There are a lot of Jerry's patients, a lot of high falls risks. Mental health, I think, are finally doing okay. So yeah, hopefully we'll have a great night.
Let's have a good shift.
And before Yoon finishes his shift and leaves for the night, Darren has some news.
So I passed the citizen test.
Good on you. You get to stay.
100% get to stay.
100%, yeah.
Yeah, life in Scotland was incredibly different to lifestyle here. Rains every single day over there. It's grey every single day.
And then I just need to wait on the ceremony coming through.
I was only ever coming to Australia for 1 year, and I actually went home after the year for a couple of months, and then something was missing, and I guess it's because I loved being over here.
And
you're a citizen.
I'll go under the oath, and then I'll be, get my Vegemite.
Yeah.
I think that's what you get.
You get a thing of Vegemite.
You do. I've had 6 years here, and I'll need to tell my family that I'll probably have an Aussie passport in the next couple of months. And I don't know how well that'll go with, my dad's pretty annoyed. When I told him I was going for the test, he was like, no, you're Scottish, you'll stay Scottish.
Well, good on you. Congrats. I'm sure you're very happy.
Yeah.
You won't get deported now?
I told you, and I've told, a couple of people know, but I don't know. Guys have been quite busy today. They don't want to hear my achievements when everyone's struggling. That's what I was saying about my dad going to probably kill me for getting a citizenship. I posted on my Instagram and it flicked to Facebook the picture of the test.
Oh.
And then my nana's replied straight away, well done, Darren, but remember you'll always be Scottish. So I'll need to probably make a phone call to her and try and talk her
that everything's okay.
I'm Scottish and I will come home, but just...
Not anytime soon.
Not anytime soon. Happy for us to start?
Yeah.
Down to fascia, that's good.
Perioperative nurse Patricia will be one of 2 nurses assisting Dr. Leslie to remove Peter's cancerous prostate.
This is the robotic surgery, and we just call the Dr. Robot because it's operate.
While Patricia takes on scout duties, Anita's role will be the scrub.
So a scout nurse is like the right hand of our scrub nurse. So what we do is we prepare everything for the scrub nurse. We anticipate what they would be needing, and we also have to be focused on what they're doing.
Traditionally, the prostate is removed by large incisions in the pelvic area.
Given the liver surgery, all the adhesions, hopefully just up there, and hopefully down here towards the pelvis where the prostate is, there won't be any issues.
Today, Dr. Leslie will employ a highly advanced technique using a $2 million state-of-the-art robot.
Patricia, drive it in.
Through 4 small incisions in Peter's abdomen, interchangeable instruments attached to the robot's arms will perform the actual surgery.
These are all robotic instruments. These are specifically designed to be integrated into the robot, and I'll be able to control the tips of these instruments via a console.
Can I have a Tegadome as well, please? Thank you.
Crucially, Anita's and Patricia's focus will be to closely monitor the 3D screen, predicting what will be needed every step of the way.
The beauty of this kind of surgery is we can see on the screen what we are up to, and we can get ready for the next steps.
The dangers of doing any procedures in the theater, so teamwork is really an integral part of the surgery.
We got a good team here.
The robot allows us to put very small instruments inside the patient, including a camera, and so we can perform more and more complex operations for our patients. There's quite a lot of adhesions down here.
Finding scar tissue is not what the doctor had hoped for. Peter's surgery has become much more complicated. Peter's surgeon has hit a stumbling block while removing the rural mechanic's cancerous prostate.
There are some adhesions down in the pelvis.
Even with the use of a high-tech robot for the procedure, it will add risk and unexpected time to the operation.
So these are the scar tissue. So we have to be very careful and divide these adhesions so that we can move the bowel out of the way so that we have good access to the pelvis and the prostate.
Once the scar tissue is removed, Dr. Leslie works to detach major organs to the prostate and harvest important tissue.
At the very end of operation, this layer of fascia is going to perform a very important role in supporting the urethra and bladder neck to help with continence.
Incontinence is one of the major post-operative risks for Peter.
Everything's fragile. I can tell already that the immunosuppressant medication that he takes for his liver transplant has sort of caused his tissues to be a little bit more fragile.
It may cause unnecessary bleeding.
So now we have to put these Hemalock clips on these blood vessels.
Scrub nurse Anita is a step ahead, preparing the clips.
These are the tiny clips to clips around the small vessels and the small tissues.
Once clipped, Dr. Leslie can cut the vessels without bleeding.
Yep. Perfect. Good job. Well done.
After all, I'm your favorite scrub nurse.
Yeah. You're all my favourites, sorry.
The prostate not only produces seminal fluid, it also helps regulate the flow of urine.
This is the most important part. We are finally getting out the prostate.
We've now separated the prostate, which is here, from all the surrounding structures, which include the bladder, the vas deferens, the blood supply, And now all we're left is this very thin connection of tissue. There we are. Now the prostate is completely free and mobile.
So I need to just get ready the bag, and we all ready to put the prostate in the bag.
Tissue Dr. Leslie harvested earlier now acts as a sling to support the join of the urethra to the bladder.
And I found that it can help continence in my patients. You know, quality of life is very important. It's one thing to remove someone's cancer, but if they're functionally seriously impaired and their quality of life is poor, then you've not necessarily done them a just surgery. Thank you. Perfect. So important to work as a team with these complex operations.
After 4 hours, there's only one test left.
So we just have to test, so make sure we don't get the leak in that junction of urethra and bladder. And there's no leak. We're very happy, Scott.
I'm happy. Thanks, Anita.
So that's a leak test done.
With no leaks, it's hoped Peter will not be incontinent post-surgery.
This operation hopefully is a life-saving operation. He had aggressive prostate cancer, and the goal of this operation was to remove all of his disease, which you know, I'm confident we've achieved that. But hopefully, given that he had a minimally invasive approach, he's going to make a very quick recovery. Hopefully he'll have minimal pain on the ward, out of hospital as quickly as possible, and back down to his family as soon as possible as well. And Anita, well done.
Yeah,
thanks
thank
for that.
you.
Yeah, my favourite scrub nurse apparently. Okay.
Oh,
These guys will be jealous.
Thank you.
I'll see you guys later.
See
bye.
you.
Bye.
Being a part of the team, it makes me very happy, and it feels really good and very satisfied.
We'll stitch you up.
I'm actually living a dream job, like lots of people only dream, but I'm actually living my dream.
It's a few days after Peter's surgery to remove a cancerous prostate. With no visitors allowed under COVID restrictions, patients rely even more on nurses during recovery.
The downside of being a perioperative nurse, we rarely get to have a nurse-to-patient interaction. More often than not, we only get to see them in the anesthetic bay, so they're gonna be wheeled out into the recovery without knowing us. I'm heading to Peter's room right now, see how he's recovering so far, have a chat with him, see how he's going. So it's nice to know the patient when we can. Hi, Peter.
Hello.
Hi, how are you?
Good, thanks.
I'm Patricia. I don't know if you could still remember me, but I'm one of your scout nurses inside the theater. How are you feeling today?
Yeah, it's pretty good.
That's good.
I don't feel like running around the block or anything just yet, but I'll get there.
It's always a waiting game after the procedure because we won't know how the patient's body would react to such type of operation being done to them. Can you urinate quite normally now?
Still got the catheter. I got that in until next Thursday.
All right. But I heard you're going home tomorrow, aren't you?
I'll come back up next Thursday to get that out.
Tests after Peter's surgery have shown no evidence of cancer anywhere else.
I feel really good knowing that we really did a good job throughout the procedure. Everything went well, and Peter is going home back to his family without complications, minus one cancerous prostate. Hoping for your fast recovery. Yeah, all the best.
Yep,
take care.
You take
Bye.
care. Good stuff, so very grateful. Yeah, if you've got something going on, you think something's going on, go and get it tested straight away. It is a killer, but if you get early enough, it's not a killer.
Hi. How are you? Being a nurse has its pros and cons. We should be available 24/7. We don't have like that much time with our family compared to other professions, but the feeling of helping people is very rewarding, so I would rate it like 11 out of 10. I wouldn't trade being a nurse for anything else.
It's the end of ICU nurse Ali's last shift at St Vincent's before she heads to the UK.
Definitely going to miss making Australian hospital beds. I wonder what UK hospital beds are like. I've looked after a lot of British patients in the past, so might just have to make a bit more tea.
And her colleagues are up to something.
Just letting you know we're having Ali's surprise very shortly.
A surprise?
Yeah, because it's her last shift.
Oh, sorry.
Danny, just letting you know we're just setting up Ali's farewell thing in the tea room.
Okay.
I am moving to the UK. I'm really ready to spread my wings and do something different.
Oh my God. Thank you. Oh my goodness. Oh, this is lovely. I feel very special.
My fellow nurses are what get me through, definitely. We very much lean on each other, comfort each other. I honestly wouldn't get through a lot of the things that we see or that we do without them.
Like, honestly, I feel so...
There's no job like it. It's just very unique in the connections that you make.
3, 2, 1.
There are so many people in my life that are going to be so happy that I'm chucking these out. Bye, Berkeys.
You know, nurses don't just stroke your brow and grab a bedpan. We work hard. We get right in the nitty-gritty of it all. We work so closely with the doctors.
That's it.
We do a lot more probably than people really realise.
I think nursing anywhere in the world, when people come into the hospital, they see us as someone that can sit down and listen to them and really take on board what's actually going on with them. People do see nurses as hope.
Me, I'm not wasting time because everyone dies gets put in the ground. I'll take just what I got, right to the top, my glory found.
Hold on. All right, hand time, guys. When you're dealing with life and death, it's very stressful. But I feel like we make a big impact, and so it makes it worthwhile.
Being a nurse is like being a hero, like saving lives, one operation at a time. It's very rewarding, and you have this feeling within yourself that you've made a person's life better by doing what you love most.
I'm incredibly proud to be a nurse.